Richard. Charles is manager of the Trauma Intensive Care Unit. And Charles is presenting poster number 5, which is called Families Benefit from Hand Massage with Essential Oils in the ICU, which is a very interesting interventional study that she's done up there. And I'd like to know what got you interested in essential oils and hand massage in the first place.
Well, Dr. Rush is one of our trauma surgeons, and he started ordering it for more and more of our patients because he saw the effects of aromatherapy and how it could help the patients relax and also help with blood pressure, heart rate, things like that. And so we only have a few aromatherapists in our hospital, and so our hospital offered a course, and I applied for a scholarship from the foundation, and they accepted me into the class, and it was a 2-year class that I had to do.
So this came out of your class?
Mm-hmm. It's actually started as our final is a research study, and usually it's just a few week thing, but this research study it grew into a year-long study, and now I'm going to have a publication, so that's really exciting. So it started from something really little, and just grew from there.
Okay. Well, tell us a little bit about the study. How did you get things organized, and what exactly was your intervention?
The study, it started out, Dr. Rush and a group of us, there's a few nurses, we talked about what we wanted. We wanted to somehow involve our families and see if the aromatherapy, we saw it worked on our patients. We wanted to see if it would work on our families. And so we thought, it'd be great to involve them in the care of the patient, and it may help decrease their anxiety. So what we did is we wanted them to give the aromatherapy, and at the same time when they're giving the aromatherapy, they're also getting the essential oils in their hands. So it's not only going to help the patient, but it's going to help the family member.
Okay, so you had to teach the family members how to do this intervention.
Yes.
Right?
Mm-hmm.
How did you go about doing that?
We would demonstrate, and then they would do a return demonstration, and we would just follow up with them, make sure after a few sessions and making sure they were still doing it the right way, and just checking in with them if they have any questions. It's not very hard. It's just really rubbing the oils into the skin. We use the M technique, so there is a technique to it, but you don't have to. I mean, you can just rub the oil into the skin.
Well, I brought some essential oil today because I'm curious to see this myself. And my intern, Pratika Bach from UNT, is here, and Chelsea's going to show us exactly what she did with the families.
Sure. So ours was a liquid form, so we would just show them. Actually, wouldn't have any jewelry here. Just put a little bit of essential oil. Ours was bergamot, and you put it onto the skin. And you do everything in a motion of 3, and so you rub 3 times their palm, and you move down to their pinky, and you rub just like circular motions 3 times over each of the knuckles. Go down to the tip. It's just supposed to be relaxing, and plus it's rubbing in the essential oil. And you stop. And go to the next one. So it's just a hand massage with the essential oil.
How does that feel, Rajita?
It feels good.
Thank you. We won't go through the whole thing. So how many families did you teach?
We taught 15 to do the intervention.
Okay.
Then we took 15 family members and didn't do the intervention to see.
Okay.
That would be our control group.
All right, so you had a total sample size of 30.
30.
And you taught the intervention to 15.
Yes.
And then 15 you didn't teach the intervention
Right.
to. Okay. And how long did it take for you to get all your data? A few months anyway.
Yeah, it took like 6 months. I mean, it took a while.
Right. Sometimes people think this goes very quickly.
And it doesn't.
Not always. No.
Yeah, we thought we would be done in a couple weeks, and yeah, it took months.
Okay. Did you notice anything interesting in your recruitment?
We noticed that it was mostly women. Sometimes when we would approach the men, they didn't want to do it. So I don't know if it was just they weren't as comfortable with maybe giving care like to the patient, or if it was the aromatherapy. I'm not really sure.
Okay. And what did you learn?
What do you mean, like our
Was
results?
this a good intervention?
Yes, I learned that this intervention was effective. I think we did see a decrease in anxiety and depression levels of our family members who did provide the intervention. We're not sure if it was actually the aromatherapy, the massage, or it could have been just participating in care.
Right, exactly. You use the HADS tool, which is well known in hospitals, and I believe, looking at your poster, that you're saying you had a significant difference in anxiety scores between the two, but you also had a trend in depression. It looks like you just didn't quite have a large enough sample to find that effect, but there's likely is an effect.
Right, so we're hoping that we'll be able to expand this and be able to see, if there was a decrease in anxiety and depression by doing a larger trial. Okay,
good. And you said you're going to be publishing this. Where's it going to be?
American Journal of Critical Care, AJCC.
Good. American Journal of Critical Care. We look forward to reading it there.
Thank you.
Okay, thanks a lot. Yep, see you.